Hi everyone, it's Natalie. We are broadcasting from the floor of Spare Bedroom Studios today. I have a question for you. What do all of these things have in common? We've got tubing, barbells, plate weights, dumbbells, mini bands, medicine ball, the human body. The answer is they can all be used for resistance training, and that's going to be the subject of our educational video today. So let's get started. So again, let me put a little context around this. When we talked in the last video about cardiovascular exercise, I told you that was one of the three kinds of exercises you need to be doing to ensure that all of your body's physical fitness needs are being met. Resistance training is another one of those. So what does resistance training mean? Let me give you some synonyms first. So when you hear the terms resistance training, weightlifting, strength training, pumping iron, all of those terms refer to the same kind of exercise. And resistance training is exercise that is specifically done to improve any of these three properties of skeletal muscle. Property one is muscular strength. That's a measure of how much weight can be lifted. Somebody who can lift 250 pounds is said to be stronger than somebody who can only lift 150 pounds. Muscular endurance is how long it takes your muscle to fatigue or exhaust before it can't contract anymore. And muscular power is how fast your muscles are capable of contracting and moving weight. So a proper resistance training program, depending on what your goals are, can improve any or all of those three. Okay, I've already shown you some of the tools of the trade when I was on the floor, but there are a few other things that you can use that I didn't have examples of. One of them is the kettlebell, and the other is resistance training machines. Now, the advantage of the free weights like the dumbbells, the barbells, the plates, the bands, the tubes, the medicine ball, the kettlebell, your body weight, is that they are fairly portable. You can pick them up and move them from place to place. Machines, on the other hand, are big and bulky, and they are typically designed to do one exercise at a time. So if you wanted to do a full body workout using resistance training machines, you would probably need 10 or 12 of those to get everything done. With a good set of free weights, you will be able to do a full body workout with a minimal investment and minimal space requirements. Now let's talk about the primary beneficiaries in your body of resistance training, and that is your skeletal muscle system. So when you resistance train, especially to develop size or strength or power, the way your muscle changes is that it increases in cross-sectional areas, so it gets bigger. Now, the reason that resistance training is important over the entire lifespan is that this is the only kind of exercise that will prevent or reverse two conditions that you might encounter during your life. One of them is atrophy and the other is sarcopenia. I'm going to talk about each of those separately. Start with atrophy. Atrophy is the loss of skeletal muscle mass due to disuse, immobilization, sedentary lifestyle, or disease. Now, some of you may have experienced some degree of atrophy associated with your cancer treatment, especially if you had a surgery that involved you not being able to move an arm or a shoulder. That is common in breast cancer surgery. So you may have noticed after a period of not being able to use that arm the same way you use the other one, that the muscles were smaller and not quite as strong. That's an example of atrophy. The picture on this screen is an example of extreme atrophy. You can see very well developed muscles on one side of the body and very small muscles on the other side. So atrophy is often asymmetrical like that because it applies to a limb or a body segment, and a proper resistance training program will restore that muscle to be as strong as the same muscle on the other side of the body. Now, sarcopenia, on the other hand, is the progressive and generalized loss of muscle mass and strength that comes with aging, whereas atrophy tends to target or be restricted to a specific limb or body part. Sarcopenia is happening everywhere. And again, the only kind of exercise that is going to restore that muscle mass or put the brakes on the loss of that muscle mass is resistance training. Now, it is important to note that when you resistance train, and especially if you want to reverse or prevent one of these two conditions, is that you have to make sure that the training load or the weight that you're working with exceeds the load that those muscles encounter when you do your everyday activities of daily living. If that weight does not exceed that, then the muscle will not be induced to become stronger or larger. Now let's talk about the other benefits of resistance training. When we talked about cardiovascular exercise, I told you there were certain kinds of cardio that would directly improve bone density. Resistance training is another form of exercise that will improve bone density. When you overload the muscles with weight, you are also overloading the bones. Now, when the muscles pull on those bones to cause the body segment to move, that's a force that's delivered to the muscle, and that is a stimulus for the bone to become stronger. So if you are exercising to preserve your bone density or reduce the loss of it, then you need to make sure that you are including resistance training in your program. Now, people who resistance train generally have better balance and coordination than people who don't, and that translates into a lower risk of falls. When you resistance train, your brain has to form a movement pattern in order to cause certain muscles or muscle fibers to fire and move your body. That brain-muscle connection fosters balance and coordination. And people who resistance train develop that to a higher degree than people who don't resistance train. Now, as you can imagine, if you are strong and stable and coordinated, you might be more inclined to engage in activities outside your home, more social type interactions. And that contributes to an overall better quality of life when you're more willing and able to engage. Now, if you are somebody who is at risk for lymphedema, either in the upper or lower body as a result of your cancer treatment, it's important to know that a good progressive resistance training program can help reduce the risk of you developing lymphedema in the first place, or reduce the severity or the number of exacerbations of existing lymphedema. Now, the reason for that is when you resistance train and make your muscles stronger, you are less likely to injure those muscles doing some mundane activity in life, like picking up a box that was heavier than you thought, or picking up a grandchild. Also, everybody is concerned about being able to live independently as they age. People who are stronger can take care of themselves for longer and live independently longer than people who are not as strong because they don't resistance train. And if you think about how you spend your day, a lot of the activities that you do involve some degree of lifting, pushing, pulling, picking up and carrying objects. So the more you're able to do that for yourself, the longer you'll be able to live independently. So let's talk about guidelines. American College of Sports Medicine has guidelines for resistance training, just like it's got guidelines for cardiovascular exercise. Now, let me introduce a couple of terms I know you've heard us use in the gym. You may not know what they mean. Reps, or short for repetitions, refers to one movement of an exercise. So one bicep curl. A set is a group of repetitions that we do one after another. So the number of sets and reps you need to do depends on what specific property of muscle you are most interested in developing. People who want to develop muscular strength and lift heavier weights are advised to do 8 to 12 repetitions per set of their exercises. If you are someone who would rather focus more on muscular endurance, then the recommendation is for you to do 15 to 25 repetitions in each set of exercises that you do. Now, if you are somebody who is most interested in developing muscle power, then the recommendation is to engage in plyometric movements, and that will be the subject of a different video. But just know right now, in general, plyometric movements are fast, explosive movements that cause the muscles to contract rapidly, and those often include things like jumps or ballistic movements, forward, backwards, side to side. Those kind of movements develop the muscle property of power. Now, how many sets should you do of those repetitions? Well, it's generally recommended for strength and size development that you do 2 to 4 sets of each exercise for all of the major muscle groups of your body. And the major muscle groups of your body live in your shoulders, your arms, your chest, your back, both the upper and lower, the abdominal area, the hips, the thighs, and the lower legs. If you are training more for muscular endurance, it's recommended that you only do 1 or 2 sets of each exercise. And the reason for that is you are doing a lot more repetitions in each set than somebody who is training for strength. And this is an important concept. Each set that you do should be performed to fatigue, but not failure. So let me tell you the difference between fatigue and failure. Fatigue is simply the muscle beginning to tire and the repetitions feeling harder to do. Failure is when the muscle can no longer contract and move that weight. So by the end of the set, we do want your muscles to be feeling fatigue. If you get to the end of the 12 or however many repetitions you're doing in that set, and you feel like you could just keep going on and on because they're not getting any more difficult, then that's a signal that you are working with a weight that is too light for what you're trying to accomplish. So next time, pick something bigger. And another set of terms I'll throw out here and talk a little more about later include our multi-joint and single joint exercises. So you want to make sure that you are including some of each type of exercise in your program. Now, multi-joint exercises are exercises that involve more than one joint moving at a time. So think about the overhead press. We start with the weight here at shoulder level, and then we extend the arm up toward the ceiling until it's straight, and then we bring that weight back down to the shoulder by bending the elbow. That movement involved my elbow and my shoulder. So that is a multi-joint exercise. A single joint exercise is the bicep curl, where you lift the weight and lower it. The only joint that's in motion during that exercise is the elbow joint. Now, the advantage of doing multi-joint exercises is that they involve a lot of muscle. When I do that overhead press, I am involving the muscles of my arm and my shoulder, and there are several of those. Now, I guess you could call it a disadvantage of a multi-joint exercise is that not every muscle that is involved in that movement is getting the same amount of work. So that's where the single joint exercises come in. Okay, now how often do you need to do this? Well, the good news is that you don't have to resistance train nearly as often as you need to be doing cardiovascular exercise. The recommendation is that you resistance train on 2 or 3 non-consecutive days of the week. Now think back to our exercise classes. We always did resistance training on Tuesdays and Thursdays or Tuesdays and Fridays. And the reason for that is that your muscles need a little bit of time between resistance training workouts to undergo a repair process. Now, what is actually happening in your muscles when you do resistance training is you are causing tiny little microscopic tears in the muscle tissue. And the repair of those tears is what makes the muscle stronger. And you need to make sure that you're allowing enough time for that repair to happen before you do resistance training again for that same muscle. So I want you to always keep in mind the golden rule of resistance training. And that is that you don't want to resistance train the same muscle or group of muscles 2 days in a row. So your frequency of resistance training is going to be a lot less than your frequency of cardiovascular exercise. Okay, now let's think about goals of programs. If your goal is to improve your strength or your endurance or your power, then you need to focus on progression. Now, progression is simply changing something to make it harder for your muscle again. So when your muscle adapts to the training weight that you're using and those repetitions are no longer fatiguing you by the end of the set, then it's time to change something. So there are a few things that you can change in order to cause yourself to progress. One thing you can do is you can increase the number of sets that you're doing of each exercise up to 4. So remember we said that if you're training for strength or size, you should do 2 to 4 sets of each exercise. But if you're training for endurance, you should do 1 or 2. So you could, if you have not maxed out on the number of sets that are recommended, you could increase the number of sets by 1. If you have maxed out on the number of sets that are recommended, recommended, then it is time to increase the training weight that you're using. But when you increase the weight, you also want to decrease the number of sets that you're doing back down to the minimum recommendation. And that would be 2 if you're training for strength or size, 1 if you're training for endurance. Another thing that you can change is increase the number of training days that you're doing. So if you are only doing resistance training 2 days a week, you could throw in a 3rd day a week. Any of those 3 things would be sufficient to progress you and cause your muscles to adapt to a heavier weight. Now, when you have achieved your goal and all you want to do is maintain the strength, the endurance, the power that you have, then all you need to do is continue training. And it's important to continue training with the same weight that your muscles are accustomed to using. Don't back off on the weight. Now, the science shows that as little as 1 day per week is the minimum that you have to do to maintain your strength, your endurance, or your power. However, I am not in favor of that model. I would still rather see you do 2 days per week, just because more days per week better reinforces the habit of doing resistance training. Also, if you're doing the 1 day a week model and this week you do your training on Monday and next week you do your training on Friday, that's a pretty long span between resistance training sessions. So I think you're better off with at least 2 days. And important to keep in mind, when life gets in the way or you get injured or you have something that goes on that prevents you from being consistent with resistance training or causes you to not be able to do it for a period of time, when you start back, you will need to reduce the weight that you use and then gradually build back up from there. I would rather see you err on the side of caution and start with a weight that is too low than have you start with a weight that is too high and cause yourself a severe case of delayed onset muscle soreness and then have to wait for that to resolve before you start resistance training again. Okay, so let's talk just a little bit about the exercises and the muscles that are worked. This may be a subject of a future video, but I have divided the exercises that we often do in our group strength training into free weights, that list of free weights, and I've got them broken down by single joint and multi-joint exercises, and also the machine weights or the machines that we have for resistance training and the muscles that they work and which ones are the single and multi-joint exercises. So as I said before, the best resistance training programs will consider the goal of the exerciser and blend single joint and multi-joint exercises to make sure that you are developing all of your muscles well. So let's talk about resistance training during cancer treatment, because I know many people who are currently in our program are doing this program while they are undergoing either chemotherapy or radiation therapy. So it is important to remember when you are going through cancer treatment that any exercise that you do should be what we call symptom limited. That means that the symptoms that you experience today dictate how much, how long, how hard, and even if you exercise today. How you feel today may be very different than how you feel tomorrow or how you felt last week. So you need to take this day by day and let your symptoms on that particular day dictate your exercise. And know that it is okay to decrease the weight that you use or just use your body weight only on days when your fatigue is higher. We don't want exercise to pile on that fatigue and make it worse. We want it to energize you and make you feel like you have the energy to go about the rest of your day. This is good advice for anyone, but particularly those of you who are recovering from surgery, is that you need to work in your pain-free range of motion, but work the full range of motion that you are capable of working. If your range of motion has been restricted because of a surgery, that will improve over time and you will be able to work in larger and larger ranges of motion as time goes on, but always keep it pain-free. And I want you to know that some delayed onset muscle soreness is normal, especially if you have recently made a progression or you are just getting into resistance training. And delayed onset muscle soreness, we often call it DOMS, is that soreness that does not occur during the exercise. It crops up anywhere from 24 to 48 hours after you've done an exercise. And it comes in degrees, mild, moderate, and severe. Mild DOMS is okay. And that is feedback from your muscles that you appropriately overloaded them. It is that pleasant feeling that you have in the muscle that it did some work. I know everybody knows how that feels. On the other hand, what we want to avoid is DOMS that is so intense that you don't want to move your arm or your leg because the muscle is so injured. We definitely want to avoid that situation, but don't worry if you have the mild version. But if it is excessive or prolonged, then that is an indicator that you were a little aggressive, maybe used a little bit too much weight or did too many repetitions or too many sets. Now, if you have a compression garment because you have lymphedema or you're at risk for lymphedema, then we prefer that you wear that during exercise. The purpose of that garment is to exert pressure on the limb and cause any lymphatic fluid that may be gathering there to get up and out of the arm or the leg and into the body where the lymph system is capable of dealing with it. So it's best to wear that during exercise. Always watch the at-risk limb for changes, and if you notice any changes, we want to know about them right away. If you have a port for chemotherapy, then we want you to observe the 10-pound lifting restriction, especially for overhead motions, unless your doctor has given you a different guideline. And if you are exercising with bone metastases, it is best to seek professional guidance on exercise. If you came into our program and we knew that you had bone metastases, we have coached you on what exercises are safe for you to do, what needs to be modified, and what needs to be avoided altogether. Bone metastases greatly increase your risk of injury during exercise, but they are not a reason to avoid exercise, particularly resistance training. You need to be strong, but you also need to work with somebody who understands the nature of your particular bone met, where it is, what muscles are in that area, and can advise you on what movements are safe for you to do and what you should avoid. Okay, I said I always end my presentations with a picture of my dogs. These are not my dogs, but they're dogs lifting weights, so I love it. If you have any questions, please comment on this video. I'll answer your questions there. You can send me an email, you can call me. I hope you found this information helpful and look for more videos in the future. This was another long one, and I want to thank you for taking the time to watch. Bye-bye.